stop. Before you flush that toilet one more time, you need to see this. What I'm about to reveal could be the difference between detecting kidney disease, diabetes, or bladder cancer when they're still manageable, or discovering them too late when treatment becomes exponentially harder. I'm Dr. Linda Harrison, and throughout my career in internal medicine, I've seen far too many patients sit in my office with advanced disease, telling me the same devastating story. Doctor, I noticed my urine looked different months ago, but I didn't think it was serious. I should have come in earlier. Right now, your body might be sending you critical warning signals, and you're flushing the evidence down the toilet multiple times every day without a second glance. What you eliminate tells an incredibly detailed story about what's happening inside your kidneys, bladder, liver, and metabolic system, often months or even years before you experience pain, fatigue, or abnormal lab results. And here's what keeps me awake at night. The most dangerous urine changes, the ones signaling serious illness, don't always appear dramatically abnormal. Sometimes they're subtle, sometimes people notice and think, that's a bit unusual, and then dismiss it completely. But here's the truth that gives me tremendous hope. When you understand what to look for, you gain extraordinary power. You can identify these critical warning signs early when intervention is straightforward and outcomes are excellent. Your toilet bowl is literally providing you with a free health screening every single time you urinate, but only if you understand how to interpret what you're seeing. Today, I'm going to show you precisely what matters, and more importantly, what you must never ignore. Something as simple as color already reveals volumes about your hydration status, kidney function, liver health, or whether there's bleeding somewhere in your urinary tract that you cannot see or feel. The clarity, odor, and frequency of urination provide essential information about everything from urinary tract infections to diabetes to kidney stones to cancer. And at the end, I'll share 3 powerful strategies to protect your urinary and kidney health starting immediately. To help you understand this clearly, let me explain what normal, healthy urine looks like. Normal urine should be pale yellow to amber in color, similar to lemonade or light honey. This yellow color comes from a pigment called urochrome that your body produces when it breaks down hemoglobin. The urine should be clear, not cloudy, and should have only a mild odor, nothing strong or particularly unpleasant. When you urinate, the stream should be steady and strong, and you should feel complete emptying of your bladder with that distinct sense of relief. Now, here's what most people don't realize. It's not just about color and clarity. Frequency and volume matter enormously. On average, most people urinate between 4 to 8 times in a 24-hour period. If you're going significantly more than 8 times daily, especially if you're getting up multiple times at night, that's a red flag. Similarly, if you're only urinating once or twice a day, that's also concerning and suggests you're either severely dehydrated or there's a problem with your kidney function. The amount you urinate should roughly correspond to how much you're drinking. A healthy adult typically produces between 1 to 2 liters of urine daily. If you're drinking normal amounts of fluid but producing very little urine, or conversely, if you're urinating excessively despite not drinking more than usual, both scenarios demand medical attention. These patterns can indicate diabetes, kidney disease, hormonal imbalances, or prostate problems in men. Color, clarity, frequency, and volume. These are your 4 essential monitoring points. Now let's examine specific danger signs you must never ignore. If your urine appears dark brown, like cola or tea, this is serious and requires immediate medical evaluation. Dark brown urine typically indicates one of several serious conditions. It can signal severe dehydration, where your urine has become extremely concentrated, but more concerning, it can indicate liver disease or bile duct problems. When your liver isn't functioning properly, bilirubin builds up and gets excreted through your urine, turning it dark brown. Dark brown urine can also indicate rhabdomyolysis, a dangerous condition where muscle tissue breaks down rapidly and releases proteins into your bloodstream that damage your kidneys. This can happen after extreme exercise, certain medications, or trauma. If you see dark brown urine that persists, seek medical care that same day. Another critical warning sign is cloudy or murky urine. While your urine should normally be clear, cloudiness usually indicates the presence of white blood cells, bacteria, or protein that shouldn't be there. The most common cause is a urinary tract infection, which needs prompt antibiotic treatment to prevent it from spreading to your kidneys. However, cloudy urine can also signal kidney stones forming, chronic kidney disease where protein is leaking through damaged filters in your kidneys, or in some cases, sexually transmitted infections. Don't assume cloudy urine will resolve on its own. Get it checked, especially if accompanied by pain, burning during urination, or fever. Now we've arrived at the most critical warning sign, the absolute red flag that demands immediate emergency attention. If your urine appears red or pink containing visible blood, this is called hematuria, and you must take this seriously. I cannot emphasize this enough. Blood in your urine is never normal and always requires thorough investigation. What causes blood in urine? Sometimes it's from urinary tract infections, kidney stones passing through and scraping the delicate tissue, or strenuous exercise causing temporary bleeding. However, blood in urine can also indicate bladder cancer, severe kidney infections, polycystic kidney disease, or significant kidney damage. The terrifying reality is that bladder cancer and kidney cancer often present with painless blood in the urine as their first symptom. Patients feel completely fine, notice some blood, assume it's nothing serious because there's no pain, and delay seeking care. By the time they finally come in, the cancer has progressed. Here's what you need to understand. Even if you see blood in your urine just once and then it goes away, you still need medical evaluation, even if you feel perfectly fine otherwise, even if you think you know what caused it. Get it checked properly with urinalysis, imaging studies, and possibly cystoscopy, where we look directly inside your bladder. Early detection of bladder or kidney cancer dramatically improves survival rates. Don't gamble with your life by waiting. There's another concerning color variation. If your urine appears orange, this can indicate dehydration, but it can also signal liver or bile duct problems, particularly if accompanied by pale stools and yellowing of your skin or eyes. Certain medications and foods like carrots or beets can temporarily change urine color to orange or reddish, which is harmless. However, if orange urine persists despite adequate hydration and you haven't consumed anything that would explain it, get evaluated for liver function. Regarding urine odor, normal urine has a subtle smell that most people barely notice. However, if your urine develops a strong, sweet, fruity smell, this can indicate uncontrolled diabetes where sugar is spilling into your urine. If your urine smells strongly of ammonia, this usually indicates concentrated urine from dehydration or possible infection. A foul, putrid smell almost always indicates infection and requires antibiotic treatment. Don't ignore significant changes in urine odor, especially if persistent. Let me address frequency problems more specifically. If you're urinating far more frequently than normal, particularly if you're also experiencing excessive thirst and drinking much more than usual, this is a classic presentation of diabetes. Your body is trying to eliminate excess sugar through your urine, and you become dehydrated and thirsty as a result. Don't delay getting your blood sugar checked. Conversely, if you're suddenly having difficulty urinating, experiencing a weak stream, feeling like you can't fully empty your bladder, or having to strain to urinate, this can indicate prostate enlargement in men or pelvic floor dysfunction in women. In severe cases, complete inability to urinate is a medical emergency called urinary retention and requires immediate catheterization. Another warning sign is urgency, that sudden, overwhelming need to urinate immediately that's difficult to control. When accompanied by frequency and burning during urination, this typically indicates infection. However, persistent urgency without infection can signal overactive bladder syndrome, interstitial cystitis, or in some cases, bladder cancer. Any persistent change in your urinary patterns deserves medical evaluation. Getting up multiple times during the night to urinate, called nocturia, deserves special attention. While it's relatively normal for older adults to wake once during the night, getting up 2, 3, or more times regularly indicates a problem. This can signal prostate enlargement, diabetes, heart failure, where fluid accumulates during the day and gets processed at night, kidney disease, or sleep apnea. Nocturia severely disrupts sleep quality and overall health. Get it evaluated and treated. Now, let me give you 3 essential strategies to protect your kidney and urinary tract health, starting immediately. These are simple, evidence-based practices that, if you commit to them consistently, will dramatically reduce your risk of kidney disease, urinary tract infections, stones, and other serious problems. Strategy number one, drink adequate water throughout every single day. This is the single most important thing you can do for your urinary system. Your kidneys need sufficient fluid to effectively filter waste products from your blood and flush them out through your urine. When you're chronically dehydrated, your urine becomes concentrated, which irritates your bladder lining, promotes bacterial growth, leading to infections, and increases the formation of kidney stones. Here's my specific recommendation. Start your day with a large glass of water immediately upon waking. Throughout the day, drink enough so that you're urinating every 2 to 4 hours and your urine is consistently pale yellow. A good general guideline is 8 to 10 glasses of water daily, though individual needs vary based on your size, activity level, and climate. If you exercise or it's hot outside, increase your intake accordingly. Stop drinking large amounts about 2 hours before bedtime to avoid disrupting sleep with nighttime urination. Many people tell me they don't like water or they forget to drink. Make it a non-negotiable habit. Keep a water bottle with you always. Set reminders on your phone if necessary. Your kidneys are working constantly to keep you alive. Give them the fluid they need to function optimally. Strategy number two, get your kidney function tested regularly, especially after age 50 or if you have risk factors. Chronic kidney disease is incredibly common, affecting approximately 1 in 7 American adults, yet most people have no idea they have it until it's quite advanced. Why? Because kidneys are remarkably resilient organs. You can lose significant kidney function, even 50% or more, without experiencing any symptoms whatsoever. By the time you feel sick, your kidneys may be severely damaged, and in some cases, you're approaching the need for dialysis. Here's the empowering part. Kidney disease is detectable with simple, inexpensive blood and urine tests long before you feel sick. These tests measure your creatinine level and estimated glomerular filtration rate to assess how well your kidneys are filtering, and check for protein or blood in your urine that signals kidney damage. When kidney disease is caught early, we can often slow or even stop its progression with medications, blood pressure control, diabetes management, and dietary changes. You're at higher risk for kidney disease if you have diabetes, high blood pressure, heart disease, a family history of kidney problems, are over 60, or are African American, Hispanic, Native American, or Asian American. If any of these apply to you, request kidney function testing annually as part of your routine health screening. If you have diabetes or high blood pressure, this testing is absolutely essential because these are the two leading causes of kidney failure. Protecting your kidneys means controlling these conditions aggressively with medication if needed, maintaining healthy blood pressure, and keeping blood sugar in target range. Strategy number three, and this is perhaps the most overlooked, take urinary tract infections seriously and prevent them proactively. Many people, particularly women, suffer from recurrent UTIs that significantly impact their quality of life. Each infection not only causes immediate discomfort with burning, urgency, and frequency, but repeated infections can lead to chronic bladder inflammation, kidney infections, and even permanent kidney damage. Here's how to prevent UTIs effectively. First, never hold your urine for extended periods. When you feel the need to urinate, go. Holding urine allows bacteria to multiply in your bladder. Urinate before and especially after sexual activity to flush out any bacteria that may have entered your urethra. Wipe from front to back after bowel movements to avoid introducing intestinal bacteria into your urinary tract. Stay well hydrated to keep urine dilute and flowing regularly. For women experiencing recurrent UTIs, particularly after menopause, when estrogen decline affects the urinary tract's natural defenses, vaginal estrogen therapy can be remarkably effective. Cranberry products may provide modest benefit by preventing bacteria from adhering to bladder walls, though evidence is mixed. Some people benefit from D-Man nose supplements. If you're getting 3 or more UTIs annually, consult your doctor about preventive strategies, which might include low-dose antibiotics or other interventions. When you do develop a UTI, get it treated promptly with appropriate antibiotics. Don't try to tough it out or rely solely on home remedies for a true infection. An untreated bladder infection can ascend to your kidneys, causing a much more serious kidney infection with fever, back pain, and potential permanent kidney damage requiring hospitalization. Let me also address kidney stones briefly, as they're incredibly common and excruciatingly painful. The best prevention is, again, adequate hydration. Drink enough water that your urine stays light colored throughout the day. Limit sodium intake, which increases calcium in your urine and promotes stone formation. Don't consume excessive protein, particularly animal protein. Include foods rich in natural citrate like lemons and limes, which help prevent stones. If you've had kidney stones previously, get metabolic testing to determine your specific stone type and risk factors, allowing targeted dietary and possibly medication interventions to prevent recurrence. Let me bring all of this together for you. Monitoring your urine and protecting your kidney and urinary tract health isn't complicated, but it requires attention and consistency. These organs work silently and tirelessly every single day, filtering your blood, regulating your body's fluid and electrolyte balance, controlling blood pressure, producing hormones that prevent anemia, and eliminating waste products that would poison you if they accumulated. When your kidneys and urinary system function well, you feel well. But when they fail, the consequences affect every system in your body. I want you to feel informed and empowered, not anxious. You now have the knowledge to monitor your own health effectively, recognize warning signs early, and take decisive action before small problems become catastrophic ones. Start paying attention today. Every single time you urinate, take just a brief moment to observe. Make it an automatic habit. Notice the color. Is it pale yellow and clear? Notice how you feel. Is the stream normal? Are you urinating a reasonable amount? Do you feel complete emptying? These simple observations take seconds, but could literally save your life by catching serious disease early. Your health is your foundation for everything else in life. You have more control over it than you realize. Small, consistent, health promoting actions compound over weeks, months, and years into dramatically better outcomes. Don't wait until you're diagnosed with kidney disease, diabetes, or cancer to start caring about your urinary health. Start right now, today, with your very next glass of water and your very next trip to the bathroom. I'm Dr. Linda Harrison, and I'm dedicated to providing you with the knowledge and practical tools you need to take control of your health and live your longest, healthiest, most energetic life possible. If you found this information valuable, please share it with your family members and friends, especially those over 50 or anyone with diabetes or high blood pressure who absolutely need to understand these warning signs. Thank you for watching, and I'll see you in the next video where we'll continue this essential journey toward optimal health together.